I'm so privileged to be able to work on the science of vaccines, to work on bringing them through product development, doing those clinical trials, and then also having in the same career and see the actual impact of those vaccines and saving lives and what it means for families. I think there are not too many fields and not too many people who get to see something in their career move through all of these steps and actually do something to save lives.
There are so many people who she has touched throughout her career through her work. There's so many different communities geographically and otherwise who she's worked with.
The first job I had after I finished my training as a pediatrician was a job in Port-au-Prince, Haiti. I worked on a pediatric ward. The kids that I saw on that ward were losing their lives because of diseases that were vaccine preventable in the United States, in Canada, in Europe. That meant that vaccines that are life-saving were getting into high-income countries long before they were used in low-income countries. So that's been sort of the theme that has really propelled my interest over the course of my career.
She has a very strong moral compass, because every fiber in her body really is all about equity and social justice.
I think that her ability to mix and be concerned and to be able to listen to an absolute diverse range of populations around the world is quite astonishing.
I had the incredible privilege to join the Center for American Indian Health and take leadership on some pretty big clinical trials that were trying to show whether or not these new vaccines that had not yet been licensed could in fact prevent pneumococcal disease. And that was really the starting point of my career in pneumococcal disease prevention and vaccines in particular.
Kate has been a huge advocate of making sure that pneumococcal conjugate vaccines are affordable, can get to where they're most needed, are widely deployed, and used in the most appropriate way.
I've learned so much that when you trust the community, when you trust the leaders of a community, things do work out.
Her single-minded focus on having a beneficial impact on the lives of others is a very important and essential quality that I hope that as many people as possible can observe and be made aware of.
I feel so strongly that children have a right to their health.
That kind of advocacy has led directly to the vaccine being used in almost every single country in the world at the moment. The childhood health outcomes that are improved are absolutely clear. So it's been a real testament to the work that Kate and colleagues have done, that PCVs are so widely used around the world today.
Mathieu Santosham has been my primary mentor. It's a piece of advice that Mathieu has given to me many times when the road was bumpy. And that is that if you stick with what is true, if you stick with evidence, if you stick with the science, if you stick with having the best quality work that you can do and doing the right thing, it will work out.
I am so admiring of her, and I think I've spent the majority of my life trying to find little ways in which I can emulate her and bring that level of dedication and passion and also joy to the things that I choose to do.
I've never ever met a mother who doesn't love their child as much as I love my kids, and just appreciating the concern and fear of things that could take your child away that are completely preventable is a really, really touching experience, a human-to-human experience. And that's why it gets me up every morning to do that, because there is a child, an adolescent, a mother, a family on the other end of the work that we do.